Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
All right, we all know about the link between cigarettes and heart problems, right? It's pretty much ingrained in us. But what about those other ways people use tobacco?
Right.
Like cigars, pipes, or even smokeless tobacco.
Hmm.
Are we maybe not paying enough attention to how those might be affecting our hearts too?
That's such a good question. And, for a while now, the dangers of those haven't been as clear-cut as with cigarettes.
Yeah.
But some recent research has been giving us some insights, and some of them might really surprise you. That's what we're going to be looking into today.
Okay, cool. So for today's deep dive,
Yeah.
we're working with a really interesting article by Amit Khera, as well as a very thorough scientific paper that was published in the Journal of the American Medical Association Network Open,
Oh, yeah.
which is, a really respected, peer-reviewed medical journal. And the reason these sources are so good is that they've actually combined information from a whole bunch of studies done over many, many years. So it's almost like getting a much broader and more solid picture
Right.
instead of just looking at one study in isolation.
Right, exactly. Like, one study might give you a little piece of the puzzle, but when you can combine all those pieces, it gives you a much better, more complete understanding.
Right.
And that's what we're aiming to do today. Really get to the heart of what this research tells us about cigars, pipes, and smokeless tobacco. We want to go beyond just cigarettes and really understand how these products affect your cardiovascular system.
Perfect. So why don't we jump right in? What was the main goal of doing this huge study? What were they actually trying to figure out?
The big thing they were trying to understand was the relationship between using things like cigars, pipes, and smokeless tobacco, and a range of different cardiovascular outcomes, how these things impact the health of your heart and blood vessels.
Okay.
And as we kind of mentioned before, the risks of smoking cigarettes, those are pretty well known.
Yeah, absolutely.
But when it comes to these other tobacco products, we haven't had as much solid information. So it's been hard to come up with good recommendations and regulations for them. This study was all about filling that gap and giving us some solid evidence to work with.
Makes sense. So how did they go about gathering all this information from so many different research projects? 'Cause it sounds like a massive undertaking.
Oh, it definitely was a big effort. They did what's called a cohort study.
Okay.
Basically, that means they looked at large groups of people over a long period of time to see how their habits, in this case, using tobacco related to their health over the years.
Right.
And they were able to do this thanks to this group called the Cross-Cohort Collaboration Tobacco Working Group.
That's a mouthful.
It is, isn't it?
Yeah.
But they did amazing work. They managed to get and standardize information from 15 separate studies that were done in the United States, all the way from 1948 to 2015.
Wow.
So you can imagine 15 different teams of researchers, each with their own puzzle piece, and this group put all those pieces together to create this much bigger, clearer picture.
So they had a huge amount of information to work with. How many people were actually involved in this combined analysis?
A lot. 103,642 individuals in total. Their average age was about 55 and a half years, and the group was pretty evenly split between females and males, and that's the beauty of a cohort study.
Yeah.
You're following so many people for such a long time
Right.
that it gives you this really strong insight into how things like tobacco use affect health over time.
Hey.
It's much more powerful than just looking at a single point in time.
Okay, so with all this data from different studies, how could they make sure that comparing the result was fair and accurate? Like, how did they know they were comparing apples to apples?
That's where the whole standardization process was really crucial.
Okay.
So researchers, they took all the information from the 15 studies and carefully standardized it.
Right.
This was so important because it ensured that all the information on how people were using non-cigarette tobacco products was consistent. And when you have that kind of consistency, you can draw much more meaningful conclusions. You can be more confident in saying, okay, this is actually how these products are related to these specific cardiovascular events.
That makes total sense.
Mhm.
And when they were looking at tobacco use, were they just looking at whether someone had used these products at all, or did they go into more detail?
Yeah, they actually looked at it in a much more nuanced way. They defined several different categories of tobacco use.
Okay.
So first you have current use, which simply means someone was using the product at the time the data was collected.
Right.
Then there's sole use, which means they were only using the non-cigarette tobacco product and not smoking cigarettes at the time.
Got it.
And finally, they looked at exclusive use, which meant the person was only using that specific non-cigarette product and had never smoked cigarettes in their life.
Okay, so they really broke it down.
Yeah.
And when it comes to the health problems they were looking at, what were the main heart and blood vessel issues they were focusing on?
They looked at a whole range of cardiovascular outcomes. So they were looking at myocardial infarction, which most people know as a heart attack.
Right.
Stroke, heart failure, atrial fibrillation, which is a kind of irregular heartbeat.
Okay.
Total coronary heart disease, which basically covers various heart problems.
Got it.
Total cardiovascular disease, so any disease of the heart and blood vessels.
Okay.
They even looked at coronary heart disease mortality, meaning death specifically from coronary heart disease, cardiovascular disease mortality, which is death from any cardiovascular disease.
Okay.
And then, just to make it even more comprehensive, they looked at all-cause mortality. So that means death from any cause.
Wow. They really covered all the bases. So after looking at all that information, what were some of the big findings? What did they learn about how these different tobacco products are linked to those health problems?
Yeah, so this is where things get really interesting and maybe a little surprising.
Okay.
So let's start with cigars. They found that people who currently use cigars had a higher risk of stroke, atrial fibrillation, and heart failure compared to people who had never used cigars.
Right.
But here's the really surprising part. For those who only smoked cigars and had never smoked cigarettes, remember, that's sole or exclusive use. Their risk of stroke was actually higher than in people who had never used either cigars or cigarettes.
Oh, wow. That is surprising. I guess you would assume that if you're using it less frequently, like cigars often are compared to cigarettes, that the risk would be lower.
Right, exactly. It kind of challenges that assumption.
Yeah, it really does. So what about pipes? What did they find out about those?
The results for pipes were more specific. They found that currently using pipes was linked to a higher risk of heart failure compared to never using pipes.
Okay.
And when they looked at sole pipe use, so people using pipes but not currently smoking cigarettes, they saw a higher risk of myocardial infarction, also known as a heart attack, compared to people who had never used either pipes or cigarettes. So it seems like each of these products has its own set of risks.
Yeah. Okay. So we've got cigars potentially leading to stroke and various heart issues, and pipes seem to have their own specific concerns. What about smokeless tobacco? What came out of the research on that?
The findings for smokeless tobacco were pretty significant, too. They found that current use of smokeless tobacco was associated with an increased risk of myocardial infarction, that's a heart attack,
Right.
and also death from coronary heart disease compared to people who had never used it.
Okay.
And what's even more worrying is that those who were sole or exclusive users of smokeless tobacco, meaning they only used that and not cigarettes, they actually had higher risks for a whole bunch of serious outcomes.
Really?
Total cardiovascular disease, total coronary heart disease, heart failure, death from cardiovascular disease, and even all-cause mortality, meaning death from any cause, compared to those who never used smokeless tobacco or cigarettes.
Wow. Even death from any cause. That's pretty significant. It really shows you that even if you're avoiding cigarettes, these other products still carry some serious risks.
Absolutely.
Okay, so we're seeing that all of these non-cigarette tobacco products could be pretty harmful to your heart. Did the study also confirm what we already know about cigarette smoking?
Yeah, definitely. It consistently showed that cigarette smoking was linked to a higher risk for all of those heart health outcomes they looked at. It's just another stark reminder of how dangerous cigarettes are.
Right, so just to be super clear for everyone listening, this research is basically saying that even if you only use cigars, pipes, or smokeless tobacco, and you've never smoked cigarettes, you're still more likely to develop various heart diseases compared to someone who doesn't use any of those products.
Exactly. It really challenges the idea that these might be safer alternatives to cigarettes, which is something that people sometimes believe.
Okay, so we've talked about the findings, but now let's zoom out a little bit. What are the bigger implications of this research for public health? What should we be thinking about as a society?
I think the most important implication is that we need to be much more aware of the risks associated with these non-cigarette tobacco products. For a long time, those risks haven't been as well understood or communicated as the risks of smoking cigarettes.
Right.
And that might have led some people to think that they're a safer option, which, as we've seen from this research, is simply not true.
Yeah, it definitely highlights the need for better education and awareness. What do you think this means for people and their doctors? How should they be approaching these conversations now?
I think it really emphasizes the importance of having open and honest discussions with your healthcare provider. Doctors should be asking about all forms of tobacco use, not just cigarettes, and patients should feel comfortable being upfront about their habits. And it's not just about knowing if someone uses these products, it's also about having those deeper conversations about the risks and creating personalized plans to help them quit. Amit Kara, the author of that health news article we mentioned, he talked about how this research is going to change how he talks to his patients.
Right.
He's going to be expanding his risk assessments to include all forms of tobacco use.
That makes sense.
And he's also encouraging all healthcare providers to be more proactive in screening their patients for the use of these products and having those conversations about how they can impact heart health.
So it's really about starting those conversations early and making them a regular part of healthcare. What about the regulatory side of things? What are the potential implications for the people who create and enforce health-related rules?
Well, with this stronger evidence base, regulatory agencies like the Food and Drug Administration, the FDA, and other organizations around the world have a stronger foundation for taking action. The clear connection between these products and various health problems makes a strong case for putting stricter regulations on non-cigarette tobacco products.
Okay.
Similar to what we already have for cigarettes. So we're talking about things like more comprehensive warning labels and maybe even restrictions on how these products are marketed. This research gives regulatory bodies a lot more to work with when they're considering implementing those kinds of controls.
It sounds like this research is a real game changer in terms of how we view and regulate these products.
Yeah.
But like with any research, we need to be careful about how we interpret the findings.
Yeah.
So what are some of the limitations or things to keep in mind when we're looking at these results?
It's really important to remember that this was an observational study.
Right.
That means while it can show strong connections between things like tobacco use and heart disease, it can't definitively prove that these products directly cause these conditions.
Yeah.
There's always the possibility that other factors that weren't fully accounted for in the study could be playing a role as well.
Right. That's always a possibility with this type of research. What other things should we be aware of?
Well, one thing is that the study didn't get super specific about how much or how often people were using these different products.
Okay.
So, for example, they don't track whether someone was smoking a cigar every day or just once a week.
Got it.
And it's definitely possible that using these products more frequently or intensely could lead to even bigger risks.
That's true.
Another thing is that the study relied on people self-reporting their tobacco use when they first enrolled in the studies.
Okay.
And of course, their habits could have changed over the long period they were being followed, and that could have affected the results.
Yeah, people's habits can definitely change over time.
Exactly. And then there were also some limitations in terms of the types of products.
Oh.
So they didn't have a ton of detail on the specific types of cigars, pipes, or smokeless tobacco people were using.
I see.
It's totally possible that different kinds or brands of these products could have different effects, but the study wasn't able to get that granular.
Okay.
Plus, even though the total number of people in the study was huge, the number of people using specific non-cigarette tobacco products in each of the 15 individual studies was actually smaller.
Right.
So that could make the results from those individual studies a little less reliable.
Got it.
And finally, even though they did their best to account for lots of different risk factors for heart disease, there's always a chance that other things they didn't measure could have affected the results.
Okay, so there are definitely some things to keep in mind. But overall, it sounds like this research is still super valuable and gives us a lot to think about.
Definitely.
Now, we also mentioned that the scientific paper itself included some expert opinions. What were some of the key takeaways that the authors emphasized?
The authors really wanted to drive home the point that these non-cigarette tobacco products are harmful, especially when it comes to your cardiovascular health.
Right.
They were very clear that their research backs up the need for regulations to address these risks. They also pointed out that their findings about the increased risk of death from any cause with cigar use were similar to what was found in a previous really big study on mortality.
Okay.
And they made it clear that while the risks from cigarette smoking might be more obvious and consistent, these other products still pose a real threat to your heart and blood vessels.
Okay, so we've talked a lot about the study, the findings, the implications, and the limitations.
Yeah.
What's the most important message you want listeners to take away from all of this?
The bottom line is this. If you're using any kind of tobacco product, whether it's cigarettes, cigars, pipes, or smokeless tobacco, the best thing you can do for your health is to quit. And there's no better time to start than right now. This research just adds to the mountains of evidence we have that show how all forms of tobacco use are bad for your health, especially your heart.
And if someone wants to take that step and quit, what's the first thing they should do?
The best thing to do is talk to your doctor.
Okay.
They can talk to you about all the different programs and resources that are out there to help people quit. There are a lot of great options, and working with your doctor to find the right one for you can really make a difference. Remember, quitting tobacco is one of the most powerful things you can do to protect and improve your heart health.
That's such a great message to end on. And with that, I will leave you with one last thought. We've been so focused on the dangers of cigarette smoking for so long, and that's important, of course. But it's also important to remember that all these other tobacco products, while maybe used less frequently by individuals, still carry significant risks to your heart. And those risks haven't always been as clear. So I encourage everyone to learn more about these risks. You can find lots of information from organizations like the Centers for Disease Control and Prevention, the CDC, or the American Heart Association. They have great resources on tobacco cessation and how quitting can dramatically improve your heart health.
Yes, great resources.
Well, thanks so much for joining me on this deep dive. It's been a really fascinating and important conversation.
Thank you. It really has.
And to our listeners, thank you for tuning in. We'll see you next time for another deep dive into the latest health research.
See you then. Bye.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.